Hello, I am Patrick Cawley with Keystone Elder Law, and this is Keynotes, a series of conversations about issues affecting the elderly, people with disabilities, and veterans of the armed forces. In Pennsylvania and beyond, a powerhouse in the delivery of human services for people with disabilities is Keystone Human Services. Despite the similar name, it is a much broader and separate organization from Keystone Elder Law. There is no connection between the two, but I'm thrilled to hear all about Keystone Human Services today from Charles J. Hooker III, the President and CEO of Keystone Human Services. Charlie, thank you so much for your time today.
No, thank you, Patrick. Happy to join you. And it's kind of an interesting conversation about the name. We are in the Keystone State, and when Keystone started in 1972, they really wanted to have a kind of a low profile as an organization because we were providing supports for people with intellectual disability, mental health services in the community. And they wanted maybe more of a quieter name. So it was Keystone Residents when it started in 1972 and have evolved over those years to eventually Keystone Human Services. So I'll tell you a little bit about that story as we go along.
Sure. And I'm glad that you mentioned that about the history of the name because, of course, there's the double meaning of keystone being the stone in the arch that holds everything together. And when you provide what we'll get into, such a broad array of services, you really are the central point of support for a person's life when you're providing such holistic services. And it's, in our business was started by someone who deliberately did not want to have his name on the business because it was bigger than that. It was about the mission and not about a person. So I like the understated approach as well. But Keystone Human Services, as we talk today in 2020, is operating in Pennsylvania, Delaware, Connecticut, New Jersey, and then overseas. So that's a very large geographic footprint, all, as I understand it, with the central mission of supporting people who have a disability in all aspects of their lives so that they may become valued and contributing members of their communities. So going from the roots that you just mentioned a moment ago to where we are today, how did Keystone become what it is, and what is your role with the organization?
So yeah, the roots were in 1972, and I'll tell you that was the year I graduated from high school. So I was not part of the organization at that point. I joined in 1996. But what was interesting in looking back at the history is that Keystone started with a founding president. His name is Dennis Feldy. Dennis founded Keystone in 1972 as he was working at Harrisburg State Hospital, and seeing the noise, the confinement, the lack of a normal life, and just these large institutions at that point in time, he felt there needed to be a better way to support people in the community. So started to put together some ideas and ended up talking to the state of Pennsylvania, the Commonwealth, who was then interested in starting community-based services. So actually, Keystone's first program was on Green Street in Harrisburg, and supported, I think it was 6 people coming out of Harrisburg State Hospital. So as we started providing support for people with mental health needs in the community, we then were approached by a variety of individuals, primarily counties at that time, to consider helping develop services and supports for people with intellectual disability. So as Keystone grew, we started in Dauphin County in the Harrisburg area, and then were approached by Lancaster County. And it's funny, the stories I hear at that time, they were concerned about being so far away. Let's fast forward to 2020, and we're working in India. But looking at going to Lancaster County to help provide services and supports for people and community-based services there. We were then contacted by Northumberland County at one point, and that's up in the Sunbury area. And they had a provider who was failing, and Friday afternoon phone call, Dennis tells me the story that they sent somebody up to Sunbury to locate the homes, find out who the people were, and find out who the staff was, and make sure that they could, that we would take over those services, and did that on a Friday afternoon. There's been several stories like that have, led to the expansion of the organization. based on our reputation and our vision and mission of supporting people in community-based services. So, it just has expanded. I joined in 1996, and during that period of time, I was approached by a family in the state of Delaware who was supporting a young man with autism. Delaware has a program, it's the Delaware Autism Program, and people with autism essentially will graduate from the Delaware program at the age of 21, and then there's no services. So what we started to do was actually started with one community home in Delaware, took that over, and now we're providing a series of supports for people with intellectual disability and autism in the state of Delaware. Connecticut was a similar story. They heard about us. Actually, it was the director of intellectual disability services in Connecticut that heard a presentation that was given by Dennis Feldy, our founding president. And again, they had a problem with a provider up there, wanted us to come up, and the story is they sent somebody up with a computer in the backseat of their car and drove up to try to find the houses. And we have then expanded significantly and been very involved with the closure of Mansfield State Center and also now Southbury Training Center, which are the last two institutions in Connecticut. Pennsylvania continued to expand. I became part of a task force that was put together by Governor Rendell and headed by Estelle Richmond. Again, it was the situation of children with autism having certain services, and then at the age of 21, they would end up aging out of school, and that's kind of where their supports were through their individualized education plan in school. So what happens when you're 21 and you have a diagnosis of autism at that point? This was probably 13, 14 years ago. It seemed like you just kind of dropped off. You either tried to fit into mental health services, which were poorly funded, still are, frankly, and also were intellectual disability services, which many of the individuals with autism didn't qualify. And it was kind of trying to fit somebody into the wrong type of program. I was rather skeptical of the task force at that point in time, and sat on a committee that was working on developing services for adults, figuring out this cliff that was happening at the age of 21. And shortly after that, there was a request for proposal that came out from the Commonwealth to develop a program which initially, it's basically called the Adult Community Autism Program. And so ACAP was developed in order to support adults who are 21 or older in community-based services, and we have now expanded to probably about 180 individuals that we support in that program through Cumberland County, through Dauphin County, Chester County, and Lancaster. So those are the physical locations of services. These are, again, supported by the Commonwealth, and we're the direct contractor with the Commonwealth of Pennsylvania, working through the Bureau of Autism Services to provide these supports. What's really interesting about this is the model that we're using, and the model is very specific, looking at who the individual is and developing services and supports to meet that person's direct needs. We are also the provider of healthcare services. We're also the provider of any behavioral health services, any additional ancillary services. We get to figure out, in conjunction with the Bureau of Autism Services, we get to figure out what services people need, and we can ramp up services or we can drop back services depending on how things are going with individuals.
So it seems like this has come along, if I can just interject, it seems like from the original mission of looking at a state hospital and having people just, housed there, and, the environment not being conducive to the kind of services that are appropriate, it seems like the mission has come a long way from just solving that problem to now ensuring that services exist beyond the age of 21, but also providing health and dental needs, while also looking at vocational needs, while also looking at housing and the whole picture of their life. So it seems like that's
Well,
what you've provided has come an awful long way.
Well, it has, and let me kind of hit a couple of points here. One is that essentially what we are, from a mission perspective, what our job is to assure that people have a real life in the community, and not a manufactured life, not a fake life, not a regimented life, but a real life, a life like you and I would have: friends, neighbors, relationships, jobs, all those pieces. And it's difficult. It's not an easy thing to do. But what has been really instrumental with the Adult Community Autism Program is the flexibility that we have as a provider. So we really get to figure out things. Now, I would say when we're working in other services, whether it's intellectual disability services or mental health supports, we also then have an intermediary that we're dealing with, and generally those are counties. So then we have kind of different partners that we have to work with. So for example, if there's a person that you're planning, they're planning their life, recognizing at some point they may need to go into some type of assisted living or nursing home type of setting, they would be concerned about what's going to happen to their child, particularly a child with an intellectual disability. That is an adult child, usually probably 40, 45, 50 years old. So it's not that person can come directly to Keystone and receive services. What they have to do is go to the county that they live in. They have to then get on a waiting list for services. They have to enroll with the county in order to get on a waiting list for services. And then the county will facilitate them looking at providers like Keystone or some of our other colleagues that are working in the field. So in that intellectual disability and or mental health services, there's an intermediary that you really need to go through. On the autism side, with the Adult Community Autism Program, there's still an intermediary, but it's at a higher level, at the state level, and it's more of a clearinghouse of information and then a referral to us, because we're the actual only person or only organization providing the Adult Community Autism Program. Now, there are, frankly, other autism services that are out there for adults, but this one is unique because it's the way it's structured. It's structured that we are a holistic provider, in a sense, that we're doing everything. So we have to, contract with physicians. We have to educate physicians about how, some of the nuances of supporting an individual with autism, looking at accompanying people to appointments and figuring that all out. But probably the most satisfying piece of the Adult Community Autism Program has been our ability to get people employed. And, employment is like, what makes life normal for most of us. It's our jobs where we get status, we have income, we have relationships. I mean, all those things that are part of what we would call the good life, many of those are going to come through relationships that happen in an employment setting. So, that's a really important part for us. And with the individuals that we're supporting in the autism program, I believe the number is over 55% are employed. And these are not, workshop programs. These are, minimum wage and or above. Matter of fact, we talked a little bit about stories. One of the individuals that we have supported in our Adult Community Autism Program ended up working for SAP as a programmer. And he unfortunately had to leave our program because he ended up making $89,000 a year. And
that's a good problem to have.
Yeah, and therefore was not eligible for Medicaid. So that's one of the elements of the program is that you have to qualify for Medicaid services. And essentially he's got a great life, a great job, and a great opportunity. He doesn't need us right now. And those are the kinds of things that we see as success stories. And as I said, over 55% of the individuals in the autism program are employed, and or beyond that, people are looking at additional education, life training, and a variety of skills that we're working out. So I know we kind of launched into the adult community autism program, and I think that's certainly an area that you had interest in. The other, as we said, was intellectual disability services, and we are arguably, and I have colleagues that we argue about this, and it's not about who's bigger, who's stronger, who's better, but we are, I think, the largest provider of waiver services for intellectual disability in Pennsylvania. We have over 3,300 employees, and 2,800 of those are in the Commonwealth of Pennsylvania. So you can see our footprint is pretty strong as far as we have some services as far as Allegheny County, but primarily we're really pretty strong in the central area of the state, through Harrisburg, up through Sunbury, up into Wilkes-Barre, over to Lehigh Valley and Allentown and Bethlehem and Easton, down into Downingtown, and kind of fill in the blanks in between when you take a look at a map. So from a Pennsylvania perspective, we have a pretty strong footprint as far as support for people with intellectual disability.
And the mission here with the people with intellectual disabilities is roughly the same from a certain standpoint, in that you are supporting people in a way that they can live in the community, so they're not institutionalized. I mean, you're helping them, to stay in a home that they either own or they rent or whatever, and they're learning the skills so that they can live independently.
Well, actually, there's a variety of different types of supports that we can provide. So let's go to where individuals might need the most support, 7 days a week, 24 hours a day, where we would have direct support professionals in the home, and actually the home that we would own. We own a number of homes, and so the person would live in that home, and our direct support professionals and our teams would be working to provide a good life for the individuals as best as we can, trying to figure out based on what we call person-centered planning, again, focusing specifically on who the person is, what are their most pressing needs, and how can we meet those needs most effectively. And so, those are the things that kind of go into that stew, so to speak, to develop supports and services that are individualized to that person. So we may have like channels of programs, so to speak, but within those, we work very hard to make sure that the supports are individualized. There's other types of services that we call family living. We're also a very large provider of family living services, and maybe a way to describe that is almost like adult foster care, where there is a person with intellectual disability who's coming to live with a family, and then we would pay the family to support the individual 24 hours a day, 7 days a week, what they need, and provide some additional training support and some respite services for the family living providers. But for us, that's really the most natural types of supports. We're seeing a number of individuals who, as you're seeing families who moms and dads are getting older. They're unable to be able to continue to support that individual. So there's a lot of people that are living in the community that are moving into the need for these types of services. And also there's continued closure of state institutions. We've been involved with moving people out of Selinsgrove, Ebensburg, Polk. I'm trying to think of the names of that. Some of them have been closed for so long that we have, deinstitutionalized or moved people out of institutions to the community. What we're also then trying to do is prevent people who are now living with family members who might end up in a situation where the family is unable to care for them to be institutionalized. So we're really in a prevention mode from that perspective. I mean, again, back to what you said earlier, our focus is how can we create the good life for an individual in the community, regardless of their abilities, and that provide that from a very focused person-centered perspective.
And in the process, you're not only giving your energy to the whole person who has the intellectual disability, but you are certainly alleviating concerns that I know I see in our practice at Keystone Elder Law with the family. As the parents get older, of course, they have a concern. What's going to happen to our our loved one with a disability. And, so even if it's just as simple as, well, guiding them through the process of, don't leave all of your money and property to someone who is on Medicaid, because that would eliminate their eligibility. But you're taking it so much further in making sure that that there's a life ahead, and a good life that awaits that person, because I think that's probably a fear that weighs on the hearts of many of those aging parents that you referred to.
Yeah, absolutely. And I think the biggest piece, and the question that parents continually ask themselves, who have an adult child or a child with a disability or intellectual disability, mental health needs, is who's going to take care of my son or daughter when I'm gone? I mean, that's the biggest question. And what we believe is that, a strong organization like Keystone, like Keystone Human Services, is, to be there for the entirety, for the lifespan of that individual. So when we're making a commitment to an individual, that commitment is not for a month, a year, a decade, but it's for a lifetime. And so we are very clear about that in terms of our communication with families, with funders. And, it's kind of interesting. I came to Pennsylvania in 1996. And when I got here, I tried to understand the system. And I saw at that point in time, it was a county funded system. We were working with, I think, eventually ending up with working with about 29 different counties in Pennsylvania. And I always sort of thought, and then the state, I always sort of thought that was going to be the, enduring component of services and supports for the individual. Well, I don't know. We've probably gone through 13 secretaries of the Department of Public Welfare, the Department of Human Services, county administrators, MHMR, or now MHID administrators, and we're still the same solid organization that we were, starting out in 1972. So that whole piece is that I think the stability, the strength of organizations like Keystone are what is going to keep people safe, and that's really our focus.
And we've talked about two highly impactful and extensive types of services that Keystone Human Services provides, but I don't want to give short shrift to all of the other services provided by your organization. You're involved with mental health services and the Headstart program. So why don't you talk a little bit about that as well, just so I'm not glossing over huge areas of service that you provide.
Sure. Yeah, I appreciate that, Patrick. As I said, Keystone started in 1972. We initially started with bringing the first, we brought 6 people out of Harrisburg State Hospital. So those, was a mental health service. And as we continue to expand, it's interesting. I think it was about 20 years after now. I'm a little fuzzy on the time frames, but we actually brought the last 16 people out of Harrisburg State Hospital, and we're essentially the ones that closed the door on that institution. We, from the variety of different services, so mental health is really providing support for people who have severe and persistent mental illness, people who are engaged in we want to be careful to keep them out of the state hospitals. We want to keep individuals engaged in the community, and we're working around 18 counties in Pennsylvania providing those supports. The Head Start program, right now we're supporting over 1,100 families in central Pennsylvania in the Head Start program, and that's an early education program working with children in a preschool setting. But frankly, we're also doing an early Head Start program, and that early Head Start program also reaches families who are not yet having children, and so it's prenatal care all the way up through when they enter the Head Start program. So as I said, it's 1,100 individuals in the central PA area. Unfortunately, the funding that's available for that only can cover about the 2/3 of the eligible population. So you have to meet certain poverty requirements in order to be involved in those programs. And we unfortunately can only provide support to 2/3 of the population. So there's another 1/3 that still needs support. those are funded directly from the federal government, and we are the subcontract, or we are the contractor for the federal government to provide those services through Health and Human Services. So that's a very important program. In addition, we also have an assistance dog program supporting people with physical disability, sensory issues, autism, etc. You know, and post-traumatic stress disorder for veterans and others.
Is this Susquehanna Service Dogs?
Yeah, Susquehanna Service Dogs, which people say is that part of Keystone. And why don't you call it Keystone Service Dogs? Because you know, it was another agency that started a long time ago, and you know, has an excellent reputation and track record. They're an internationally accredited program for service dogs, and we have a farm out in Grantville of 56 acres where we have our kennels, and we're involved in placing numerous service dogs with their partners, i.e., individuals who need their support.
And I think you said that the people who benefit from these service dogs, but I believe I read on your website that some are hearing dogs for people who have hearing impairments, and others are service dogs who helped maybe to pick up items or help in other ways. But it's a broad range of people who can benefit.
Again, it gets down to what do people need, and how do you match that up, and then what animals and service dogs can do. So, you know, we take a look at it. It's almost like our folks, and I'm not that deep in the weeds on the service dog program, but they take a look at what a dog really likes to do, and then they build on that. So if it's a dog that really likes to pick up things or retrieve things, we have found dogs, and we can't train this. It happens that they actually can sense an individual actually having a seizure, getting ready to have a seizure. So what we can do is we can reinforce that, and then teach the dog to nudge an individual before they say, oh, I guess I'm going to have a seizure, I better sit down, and they're in a safer spot. We've also trained a dog to help an individual who was continually falling over backwards by losing balance, and now she can go anywhere with the harness and the balance dog. So, you know, they're again, it's kind of fitting the need to the individual, and making sure that we can partner or pair up. The one thing that's kind of fun, and I watched one of these one time. It was it's kind of partnering, and you bring a bunch of dogs together with an individual, and see, you know, who we always would think that the person is going to pick the dog, but it's like the dog picks the person. And so you see the dog that has that affinity towards that individual, and that really starts that match program or process. And then we have a continual training program that goes on over months before the dog actually gets handed over to the individual.
That is really amazing. And this full explanation of everything that Keystone Human Services is doing is just awe-inspiring, the way that you are improving lives all over Pennsylvania and beyond every day. So I want to thank you for your time. We've been, you know, at this for a while. You've given us a lot of information. Where else can people go to find more information about Keystone Human Services?
So you can follow us on Facebook or Twitter. We're out there. Just kind of search Keystone Human Services and we'll pop up. You can also you know, go to our website, and that's KeystoneHumanServices.org. So you can see our work there. And then, you know, the last thing I would like to point out is not to miss the services and supports that we provide internationally, but we've been working in the Republic of Moldova since about 2003. We worked in the Russian Federation for a number of years. And we are now working in India. And as we look at those pieces, I kind of go back real quickly to that keystone, and being the stone that holds up the arch. It was funny when we started to work in Russia. They wanted to try to translate that word into Russian, and it never really kind of fit. So we ended up with Keystone, which was a little Russian accent on the Keystone Service Systems or Human Services perspective. So, you know, again, our work across the world is being a change agent. Try to impact systems and create opportunities for people with disability to live in the community. And we do that across wherever we're working. And as I said, Lancaster County seemed real far away back in the day. But, we've been working in India, Moldova, Russia. We did some services and training in 𝐊𝐥𝐝𝐺, and we're continually looking at opportunities on the global footprint now that it's a global society.
Just wonderful. Thank you so much for your time and for all of this explanation of the great work you're doing.
Thank you, Patrick. It was great to speak with you, and look forward to further conversations.